Hi, I'm Dr. Agarwal, a cardiologist and clinical professor of cardiac sciences based in Calgary, Alberta. February is Heart Month. In Canada, heart diseases were ranked as one of the leading causes of death in Canadians over the age of 20, with approximately 18.5% of all recorded deaths in 2020 having been attributable to cardiovascular conditions and secondary only to malignant neoplasms. In the secondary prevention setting, there are several standards of care that have been shown to impart a cardioprotective effect, including adopting healthy lifestyle habits, a low-sodium, well-balanced diet, and regular, moderate to vigorous leisure time physical activity, smoking cessation, and attaining and maintaining an LDL cholesterol of less than 1.8 millimoles per liter, blood pressure of less than 120/80, and a hemoglobin A1C of 6.5 to 7%. Reducing residual risk within the secondary prevention setting can be challenging. Many different risk factors impart their own independent effect on the atherosclerotic progression, and identifying which risk factors or factors may be best to target for treatment can seem daunting. The 21st century culture has been criticized for providing and nourishing what author Barry Schwartz calls a paradox of choice, whereby having access to many different options can cause undue stress and problematize decision-making. How might this paradox of choice influence patient care in the secondary prevention of ASCVD? Like customers choosing a donut in a coffee shop, us clinicians often face this paradox of choice. That is, which ASCVD risk factor, including elevated cholesterol, triglycerides, lipoprotein A, glycosylated hemoglobin, inflammatory risk, or thrombotic risk, should be prioritized for the management to reduce a patient's residual ASCVD risk. What factors do you consider when selecting your donut to target in the secondary prevention of ASCVD? Although conscious and unconscious biases may be at play, it is important to appreciate that any efforts directed at minimizing a patient's residual ASCVD risk may provide a clinical benefit to the patient in terms of gains in event-free years, life years gained, and vascular age. So don't hesitate when selecting your donut. Enjoy the taste that comes with successful risk factor management, and look forward to trying the other equally delicious options during an evolving patient journey. Be clear on the envisioned outcomes and interventional goals. Setting a treatment target implies that there's a specific predefined target that must be achieved. For example, for an LDL cholesterol of 1.8, a patient displaying an LDL cholesterol of 1.7 would have achieved that target and no further treatment is required. A patient displaying an LDL cholesterol of 0.5 millimole per liter would be deemed to be far below the target, and treatment de-intensification may be considered. Setting a treatment threshold, however, suggests that any value above a specific predefined threshold value would require treatment intensification with no lower limit. It's important to remember that when it comes to risk factor management of LDL cholesterol, lower is always best. For example, the recent CCS dyslipidemia guidelines outline a lack of evidence to currently suggest that there is any CV or other risk associated with low or very low LDL cholesterol in trials with moderate duration follow-up. As cardiovascular specialists in Canada, we strive to provide efficient services that impart a maximum clinical effect for our patients. Despite the growing body of evidence suggesting that any residual risk reduction in the secondary prevention of ASCVD can provide a clinical benefit, we can still be hindered by this paradox of choice with respect to which risk factors should be prioritized for treatment. As in the pathogenesis of ASCVD itself, the management of residual risk is complex. Next time you meet with one of your secondary prevention patients, take a moment to reflect on what donut you've chosen for their treatment plan. Remember that inaction means not addressing a patient's residual risk, and this is a decision in and of itself.